Yesterday, I was with a friend when her whole body started seizing up. She was experiencing a clonic-tonic, also known as a grand mal seizure. It's the most severe kind of seizure you can have. This is the story of how her tonic-clonic seizure presented and what you can do if you yourself have any sort of medical issues that other people need to be alerted of. My friend had just gotten out of the shower when she looked at me and wasn't able to fully make eye contact. It was like her eyes were somewhere over here, and she had a far off look, like I was looking at her and I knew she needed me, but she wasn't fully there. Next thing I know, she starts slowly falling to the ground. So I help her down and make sure she doesn't hit her head on her way down. And she's laying on her back when her whole entire body starts seizing up. She lost consciousness. Her face turned cherry tomato red, and she was foaming at the mouth while her body was convulsing all over. As someone who's never seen a seizure, doesn't know a lot about seizures, this was extremely scary. I immediately called 911 and went and grabbed my neighbor, who's a cop, to serve as like a second responder on the scene so we could both monitor my friend together. Paramedics came and assessed her. If you or someone that you know suffers from sudden medical events, it can be really scary, but if you stay informed and you stay calm, it can really improve the quality and how you manage these kinds of events. My name is Kara. I myself have experienced life-threatening medical emergencies. The main one I've experienced is something called Stevens-Johnson syndrome. Honestly, there have been times in my life where I've been embarrassed of my medical issues or kept them to myself and not told friends and family about them out of fear of being seen as a burden or problematic. But in reality, the greatest gift we can give to ourselves and our loved ones is having a plan ahead of time. So here are some options for things you can do if you're someone that has sudden medical events. One of the fastest and cheapest things you can do if you have episodic medical conditions is have your medical ID on your Apple iPhone and your Apple Watch updated. First responders are able to access this from your lock screen. A second thing you can do is call emergency services at the click of a button. If you hold down the lock button and you hold down the volume button on your iPhone at the same time, a screen pops up where you can slide to call emergency services and slide to have your medical contacts notified. There's also physical wearable medical ID bracelets that you can buy, and there's maybe something out there for specific disorders that you have. So if you have a seizure, for example, there are wearables that can detect when you're having a seizure. You can also look into what your specific medical issue is and see if there's something specific in terms of a medical monitoring or alert system. Don't forget that the reason that we are on this earth is to take care of one another.